Welcome, and thank you for being with us this evening. We have a wonderfully interactive presentation on One Health Prepared. Leading this webinar is Dr. Beth Falls. Beth has taught for the program for 5 years and has worked as a research scientist at Ocean Research and Conservation Association since 2008. Among many things, Beth also developed a One Health program for Orca. And we are excited to announce that she developed our GPPH One Health course that will launch this fall B. So in a few weeks. So please help me welcome Beth here. And thank you so much, Beth, for being here. And now you officially have the floor.
Thank you. Thank you, Jennifer. And thank you all for coming to hear about One Health. One Health has taken over as my most favorite thing to talk about professionally. So excited to spend this next hour talking about it with you. I am going to actually get rid of myself, my face, and so I can just focus on the slides, and then I will come back when we have questions. But I want to start when we talk about One Health, I want to just start with a definition. And so there's actually a lot of definitions you can find for One Health, but I prefer this one because it's so comprehensive. And it's the definition that's developed through a collaboration with the Center for Disease Control and Prevention, as well as the One Health Commission. And I'm going to talk a little bit later at the very end about the One Health Commission. But there's a lot embedded in this definition. So One Health is a collaborative, multi-sectoral and transdisciplinary approach. And when I talk about One Health, I really want to focus on some key concepts. And a lot of those are in this definition. Transdisciplinary is one of them. What makes One Health unique? So it's also working at the local, regional, national, and global level. And then ultimately, the main definition is that One Health works to achieve optimal health and well-being, recognizing the interconnection between people, animals, planets, and their shared environment. So like there's many different definitions, there's lots of images that people have developed to represent One Health. Some of them are more complicated, but I really love this simple triad. And the reason that I like it is because it shows that the flow goes backwards and forwards. So when we start talking about the different issues and problems that really need a One Health focus, I think there's some commonality that we're starting to see. And that is that it's human behaviors, the behaviors of all of us over time that have impacted the health of animals and the environment to such a degree that now we're starting to see this tipping point where it's coming back and impacting our health. So it's this back and forth kind of circular relationship. And we have to keep that in mind as we work to solve these issues. So I should start by saying when we talk about One Health, it's not a discrete discipline. It's not like I'm giving a lecture on nutrition or biology or chemistry. One Health is a way of thinking and acting within this larger domain of human, animal, and environmental health. So I want you to keep that in mind throughout this conversation, and then when we start doing our case study. So what I want to do is just provide you some concepts to think about and to kind of start to embed in your thinking as you start to develop a One Health way of working within public health. So I just want to share with you why One Health is so important when we do applied research. So I want to just give you the background or the basis of what the difference is between basic and applied research. And then I want to introduce this concept of wicked problems. Some of you may have heard of that term, but I want to really dig into that and talk about why One Health is absolutely essential to solve many of the wicked problems we're facing. And then give you a clear definition of what we mean when we talk about transdisciplinary. And then when we start talking about really looking at these wicked problems, how do we understand them? How do we understand the upstream causes as well as the downstream solutions, and the importance of applying system thinking and often systems mapping to these complex wicked problems. So that's going to be the first half of the my lecture, and then we're going to dig into a case study, something that I want to present that I consider a wicked problem, and see if we can't work towards having coming up with some solutions towards that. So let's talk about basic versus applied research. You guys might have seen this before, this image. This actually came from a Chinese folk song, but it's been used pretty frequently to explain the difference between basic and applied research. And I want to be clear that when I talk about basic research, I think it's obviously extraordinarily important. Basic research is when scientists are doing research simply to gain more knowledge. And everything we know, every advancement we've made in medicine, in technology, in environmental health, all of that came through basic research. So it's important, it's absolutely essential, but it's research to understand phenomenon. And so when the way that it's done is it follows what is considered a reductionist approach. So if you look at this elephant, if you blindfolded 6 scientists and exposed them to an elephant, they would simply go to one area and study that one area. They'd never look at the whole elephant. So if scientist was touching the tail, they might conclude that they were working with a rope, or if they're touching the side, they might conclude they're working with a wall. That would be that basic research. Applied research is where you look at the big picture. You pull it all together. You have to look at how it all works together in order to make a healthy elephant. And so then I would argue that One Health is the next step above applied research. One Health is looking at the application within an individual population, but I'm sorry, applied research is looking within an individual population. One Health is expanding to how it affects not only animal health, in this case, the elephant, but other animals and humans and the environment. So it's very, very systems focused. Okay, the next concept I just want to dig into is this idea of wicked problems. And wicked problems, there's different ways to think of them, but this is, I think, kind of the best scenario of what criteria come into play when you're thinking about a wicked problem. Another way of talking about wicked problems is complex problems, but I like wicked problems because it just takes it to one step higher. So I'm using the example of poverty. I think of poverty as a wicked problem. So the criteria that come into play when you're dealing with a wicked problem, the first thing is that there's not enough understood about it. And this is a little like misleading because people think, gosh, we know so much about poverty. People are studying it like crazy, but it's such a complex, multifaceted problem that and oftentimes the more you know about it, the more you realize you don't know, that you're constantly seeing that there's all these interconnections and complexities to it. And so there's really just not enough known to solve the problem. And then the other thing that makes it a wicked problem is there's lots of different people involved in the issue. And in almost all cases, those people's opinions may differ a little, or in many cases, they differ a lot. So when there's differing groups of people working on the same problem and they can't agree, and in some cases they strongly disagree, that makes it a wicked problem. It makes it very challenging to move forward with any real solutions. The other thing that makes it a wicked problem is it has an economic burden. So the problem itself is a big economic burden, but any real meaningful solution is also a big economic burden. So a lot of times these wicked problems kind of get pushed down the road. Maybe there's just some lip service or small effort, but not a real true effort to solve it. And then it continues to grow and become more complex and a bigger problem, which makes it harder to tackle. And poverty, I think, is a really good example of that, but sadly, we can think of many others. And then the other thing that makes it a wicked problem is that there's this interconnection with other problems, often other wicked problems. So it just becomes almost bigger than you could even begin to deal with. So again, poverty is such a good example because it's really has this interconnection with housing and education and healthcare and racism, and there's so many other problems that kind of come into play. So this is why, because we have so many of these wicked problems, we really have to bring systems thinking to the if we're going to ever make any real difference. And when we talk about systems thinking, when we're talking about any aspect of health, any wicked problem that falls under that health umbrella, the One Health approach really, in my opinion, is essential. So next, let's talk about this transdisciplinary idea. So there's this continuum shown on this slide that just basically, you get your degree, you become a professional, maybe you get a PhD, and you have this depth of knowledge in one discipline, which is great. And there's often lots of jobs you can do, and you just kind of stay in your lane, you do your job. But when we think about these wicked problems, that's never going to be solved by just one professional. So then you move along the continuum, you understand that it is complex. And so you may need other people working on the same problem. And that term for that is multidisciplinary. So you bring in the other professionals and they are also working, but still everybody's kind of working in their own profession, doing their piece to bring around about change or to solve a problem or develop a program or whatever it is. And you recognize that you're really not having an impact. And so then the next step is interdisciplinary, which is where you start seeing there's some overlap, that we need to really work together and try to come together and see how we can solve this problem together. And that's good. That's really good. And there's a lot of interdisciplinary efforts going on right now. But when you think back to that definition, they use the word transdisciplinary. And transdisciplinary is really when those disciplines, when all of the people who are working on that wicked problem are really enmeshed. They truly understand. There's still going to be people with their own expertise and their depth of knowledge and skills and expertise, but the players truly understand what each other is doing. They don't just know that they're doing something and it's important, but they really start understanding how they're working together and how they're kind of putting together the pieces of the puzzle. That's when it becomes transdisciplinary. But the other thing that makes it transdisciplinary is it brings in all of the partners, everybody that's involved. So it brings in the clinicians, so the people that are working with the animals, the people that are working in the environment, the people that are working with the humans, whether it's social workers or doctors or nurses, so that they really kind of always thinking, keeping in mind this actionable, impactful outcome. And then it also should and often will bring in the communities that are impacted, whether it's directly impacted, whether you're starting with a human health concern, or whether it's the secondary impact. If you're working with the environment, always thinking about how that, if you make a change or do something to benefit the environment, how is that going to impact the people that live and rely on that environment? So that's the idea of transdisciplinary, and that's what it takes to really address wicked problems. And that's how One Health is done, or how it should be done. Okay, so now we're thinking about these One Health problems, these wicked problems. And this is important, is that understanding a problem is such a big part of One Health. It's a lot of the work, it goes into understanding the problem. And so understanding the upstream causes is really hard to do. It takes a lot of time, it takes a lot of honesty, and it takes a lot of work and a big transdisciplinary effort. And so there's a quote, it's attributed to Einstein. I don't know entirely that he said it. I know that we say he said a lot of things, but I like it because it kind of gets to what I'm trying to portray here. And that is that he said, if I was given an hour to solve a problem, I would spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. And so this is where I work. We talk about this all the time. You can't solve a problem if you don't understand it. But that is often not the case. There's often tons of money put into trying to solve environmental problems or human health problems or wildlife problems where people don't fully, honestly understand the upstream causes. And so that's what is part of One Health, is really putting in the effort to do that. So this is just my list of some of the things that could potentially impact wicked problems. Obviously, different problems have different upstream causes, but thinking about, like, if we're thinking about some of the issues that we addressed with human health, animal health, and environmental health, things like our population growth and the developments, the urbanization, the habitat loss, all of that impacts the environment, impacts animal habitat, which changes where those animals go, that can impact human health. So thinking about those types of things are important in many cases of many particular One Health issues. Climate change across the board is impacting so many things, so we can't ignore it. We have to understand how it's impacting these One Health issues. And that's just a short list. There's so many others. But then moving beyond that, we need to be honest and think about how human actions and inactions are impacting whatever it is we're talking about, and what are the motivations for that. So that's where you kind of have to bring in some professionals you may not think about. If you're, say you're a veterinarian and you really just care about wildlife, you might have to bring in some like social workers or social scientists and psychologists and things like that, because to have real problems, you have to understand why people are doing what they're doing and why they're not doing things that you think they should be doing. And that kind of segues to understanding the laws and the policies. There's a lot of advocacy groups that are constantly like kind of saying, you know, pushing for new laws and policies, which is great, but we have to understand that that's not always the end point. There's a lot of laws and policies that exist, and it's really more about enforcing them. So, I mean, a great example that we talk about where I work all the time is the Clean Water Act. The Clean Water Act ensures that all waters are swimmable and fishable. And we know that that's not true. So we don't need a new policy. We need to enforce the laws that we already have. And then we get into the really sticky stuff, like things like greed and corruption and racism. I mean, that impacts everything, all of the issues that we're dealing with. We can't ignore these things if we want to have a real impact. And just the equity issues that are so important, we need to bring those into the discussion. So when we talk about this One Health framework, there's a lot to it, but it's really essential in order to have an impact. And then when we move downstream, we need to always be thinking about, like, maybe the issue is really more of an environmental issue, but we always have to think about the impact we're having on humans and animals, and that this often is occurring in a loop. So you may have a really positive impact in the environment, but if that is not ultimately equitable among impacts on humans and animals, you haven't done your job yet. And so we need to go back and try to figure out how we can do better. And so always thinking about what are some unintended consequences. And this happens a lot. It happens a lot in environmental health, but it also happens a lot in human health. And then finally, I want to just put in the plug for public health, because really what I've talked about up to this point is just complexity. These are complex issues, and most people through their education all the way through graduate school aren't taught to think that way. Everything is so reduced. Everybody takes individual courses, and public health is the profession that by the nature of it is systems thinking. It's systems thinking is embedded in public health. And so I really think that public health are the ones, public health programs are the ones that should be training these One Health professionals and taking the lead in One Health, because it's already the way that is necessary to think to be a One Health professional is the way public health professionals are taught to think. So that's very important, or very exciting to me, working within a One Health program. I mean, I'm sorry, a public health program. Okay, so finally, I just want to make clear that this isn't really anything new. This is almost every indigenous population functioned at this level. There was always this understanding of this interconnection between the health of the people and the health of the earth, and animals were incorporated in that. That was the way of being and the way of acting. It's really just been in the last couple of generations, all of the amazing progress that we as humans have made in technology, in medicine. I mean, certainly we have better health and better healthcare than ever before, but that has come at the cost of losing this connection, this understanding of this connection. So the globalization and the urbanization and all of those things that we have done in the last couple of generations has led to this disconnect. And now we're starting to see the consequences, both large and small. And that's why we're going back to One Health, why we're going back to understanding that we can't continue down this path where we ignore the fact that there is this interconnection. So I am going to actually stop there and see if there's any questions, because the next step is we are going to do a case study. So Jennifer, do we have any questions yet?
Sorry, no, we do not at this time, but yes, okay. Please.
Does anyone have any questions or comments, or anybody have any examples of how they worked in?
Yeah, Michelle has her hand raised.
Yeah, I just have a quick question, a clarification. Is One Health part of Health in All Policies approach? How are they related?
I'm sorry, I missed that. Part of what?
There's One Health and there's Health in All Policies, right? How are the two related?
So I have actually never heard the term health in all policies.
Oh.
I've heard there's planetary health. There's a lot of different ways of discussing this. Is that from a policy course, or
yeah, that's a policy framework. I feel, Deborah, you unmuted. Did you want to add something?
Sure. They are very distinct. It's a great question. First of all, thanks for asking it. Mm-hmm. Health in all policies means you really do a close read on how any policy whatsoever, for instance, let's say housing policy or eviction policy. How will eviction policies impact human health? During the pandemic, there was a moratorium on evictions. That was terrific for many, many people. That moratorium has been lifted. More people are in shelters around the street. Obviously, lacking a home can have a huge impact on public and individual health. So I hope that clarifies it a little bit.
Yeah. So that would be but that would be embedded into One Health. So One Health would be bigger, because what Deborah just explained would be kind of related to the human health component of One Health. But as you really would dig into it, you might start understanding that, that the housing, certainly housing, and the way that houses are built, and overdevelopment and poor structures of housing and unhealthy materials impact the environment and impact the animals and things like that. And so take away. So One Health is an umbrella. It's much larger. And it's the idea of just encompassing anything you do in the human health arena. You just want to keep in mind how it may impact animal or environmental health.
Okay, thank you.
Does that make sense? Mm-hmm. Yeah, I mean, this is just an introduction. I mean, honestly, it's really just this kind of reframing, but it's great that you're already learning a lot of these systems thinking in other courses, and ways of looking at things that aren't just so clearly linear, that is just bringing into mind that the interconnection between human, animal, and environmental health.
Beth, we have another question from Mindy.
Okay.
Thanks for being here, Mindy. I'm glad you made it. What is the hardest thing to sell about this One Health concept to other professionals?
Well, I think that people are not, in my opinion, I'm just say that, in my opinion, I think that people are not always comfortable with complexity. And I mean, it's hard, it hurts your brain. And people like to have, you know, I'm an engineer, I'm going to solve this problem with engineering, and then I'm going to give you my piece. So I think it's just taking people out of their comfort zone, especially within like university structures, or really within, you know, any kind of structures where people, you know, are just used to doing the thing they do, and not, it's just a different way of opening themselves up to really having to learn, and then really having to kind of let go of some of their control. So it's just, I don't know, it's a harder way, and it's not short term. It's not, you know, I mean, a lot of what we do in this world, whether it's politicians who have to get reelected every 2 or 4 years, or college professors who have to get tenure within 5 years, I mean, that really takes away the ability to dig into these transdisciplinary, because they're not short term. So I think that's challenging. You know, it takes a really long time to really start to see an impact, you know, and people want to, like, especially politicians, we see it all the time in our work. They come to us and say, what can I do? I'll give you, or who can I give $1 million to do something huge to solve the pollution problem? And it's not that easy. And so there's often unintended consequences. Like, one big example that happened where I live is that we live near an estuary. A lot of our work is in estuaries that's just completely degraded. And back when it was healthy and vibrant, there was tons of oyster beds, and oysters are filter feeders and they clean the water. So the solution was, let's just put in a lot of oysters, independent of the fact that the rest of the ecosystem is degraded. And let's just throw them in this place. And, you know, it was $2 million project, and it was a big deal in all the papers. And those oysters didn't live, because where they were put, there was releases of fresh water, and then they didn't have the food they needed to thrive, and it was all just a big show. And so that's just how people like to work, because it's exciting. And I think that's the problem. Okay, so I was trying to think of a good One Health wicked problem that I could present in this webinar that we could discuss. So I came up with feral cats, because it's something that I've been working with a little bit. And it was something maybe that most of you don't think about too frequently. So I just want to start there. Like, does anyone have, when we talk about feral cats, does anyone ever gave them much thought, or anyone have any opinions on the issue of feral cats?
Shannon's hand is raised.
Let's hear it, Shannon.
Full disclosure, I've worked with feral cats for almost 30 years. So,
Okay.
I know that well, it is a great example of a wicked problem, because we have too many cats basically in the United States, and many of them are wild, and so they do cause problems. People don't like them around their house, for instance, because they can make your flower beds very stinky. Obviously, people worry about disease transmission and things like that. But I always do point out there are some beneficial aspects also.
Okay, so can you say that? Because we're going to talk at the end. And so you'll be a great contributor to the end of this. That's great. I'm so glad you're here, Shannon. Go ahead, Jennifer.
And I see Leslie, that person's hand is up as well.
Okay.
I actually worked as a vet tech for about 11 years, so I have a lot of experience with cats as well. Usually the first thing that comes to my mind with cats is any like toxoplasmosis or anything like that would be of a concern. And also just, you know, another kind of like a burden onto like what other wildlife too. So
right.
Those are first things that come to my mind.
Yep. Perfect. I'm so glad you guys are here. So this will be quick, because I'm going to run through why I consider it a One Health issue and not just an animal issue. And then we will brainstorm on solutions. And so this is really great, because there's just, so let me ask you, sorry, Shannon, so was your role as a volunteer or a health professional?
I was actually president of our Humane Society, and I
Okay.
started our trap, neuter, release program.
Great, perfect. So you see, like we already have 3 different professionals that all have some experience and some thoughts on this idea of feral cats. So let's just run through really quickly why I consider it a One Health issue. So before we do that, let's just talk about upstream causes. There are currently estimates are anywhere from 60 to 90 million feral cats in the United States. And that's about equal to how many domestic cats there are. So that's a big problem. I mean, I think we can all agree on that there's a lot of feral cats. Different populations have more than others, but there are a lot of them in the United States. So what are some of the upstream causes? Does anyone have thoughts on why we have, how we got here?
People.
Actions and inactions, right? Yeah. So the upstream cause in this case was, this is exactly what I said at the beginning. So it's human actions. Like when I remember when I moved into my neighborhood, there were these 2 cats running around. And I was talking to one of my neighbors and I said, where are those cats from? And she said, oh, well, we got them as kittens, but then I had a baby and they were too much work, so I just let them go. And you know, that's just, what is the motivation for that? What is the ignorance or lack of knowledge? And so this is an example that I was talking about, where it's human behaviors that have caused these problems that are now potentially coming back and impacting the health of humans.
And Leslie also offered another comment: lack of spay and neutering and having indoor-outdoor cats. So I just wanted to get the chat comments.
Right, great, yes, right. So yes, so it's still, and so Leslie, would you still consider that a person, a people, a human actions?
Yes, absolutely.
Yeah. So it's human actions. And again, I mean, we're not all bad, right? We just, a lot of times it's lack of knowledge, but it's still human actions that got us here. So why is it a One Health issue? So first of all, the cats are just predators. They're instinctive predators. And just looking at some of my statistics, they've contributed to the extinction of at least over 60 species and continuing. Again, more in some areas than others, but it's their nature. They are predators, and they kill a lot of birds and other animals. And so it's a huge impact on wildlife. So that's one reason why the animal health. There also, Leslie brought up toxoplasmosis, which is cats release parasites, Toxoplasma gondii, which is can be potentially harmful to the health of a variety of wildlife. This is an example of a Hawaiian monk seal that had toxoplasmosis. And then also, when we're thinking about human health, I mean, this is not a lovely life for these cats. I mean, it's a very hard life for the cats. And so it's a significant issue when we talk about animal health. And then from a human health perspective, again, it's the Toxoplasma gondii, the toxoplasmosis, that's the biggest concern. There's other concerns, just if you know, the any kind of feces that gets into the garden and or the playgrounds and things like that, but mainly Toxoplasma is gondii. And we all know, anyone who's ever had a baby has been told not to change their kitty litter. But because of that, because the biggest impact of Toxoplasma gondii is on the developing fetus, but it also can cause some symptoms. In most people, in most healthy people, it's pretty benign, but in people who have pretty severe immune deficiency, it can be significant. And then there's some evidence, again, I think sometimes this has been, the science isn't completely strong, but there's starting to be some evidence that the Toxoplasma gondii can impact psychological health. Some speculation that it impacts things or can lead to things like schizophrenia or other mental health diseases. Again, that's early on, but it's something that we should be aware of. If we have all of these cats, the potential for that Toxoplasma gondii to get into things like row crops and seafood and things like that. And there is starting to be more and more evidence that that parasite is being found within the food chain, certainly the aquatic food chain. And so it is potentially a human health concern. And then from an environmental perspective, really, I mean, what we talked about with species, changing the biodiversity has a big impact on the environment. But then also the oocysts of the Toxoplasma gondii can get into soil. The potential is for it to get into crops, but certainly if it gets into the soil and then it affects the microbiome and the biodiversity of the bacteria in the soil, that could have a potential impact on environmental health. So I think it's a clearly, it is not strictly an animal health issue. I think it is a One Health issue that we need to address. And I think it's a wicked problem because of what we talked about earlier. The things that make it a wicked problem is it's complex, because there's not enough understood about how to really solve the problem. There's very differing opinions. Would you agree with that, Shannon, that the opinions are pretty different on how to address it?
Well, I think that there's agreement in how to address it, but lack of will to do so. So things like really aggressive, like I'll just give our example. We started a really aggressive spay neuter program. We spayed and neutered low-income people's cats for free. We trapped, neutered, released feral cats. And we actually did 10,000 spay neuters in 1 year, which for a very small, poor shelter was a lot.
Mm-hmm.
And we had an impact. We had fewer and fewer cats around. The problem is that most municipalities are not willing to put that much money into something.
Right.
And
it's expensive. So yeah, so it has the economic burden. And there
Yeah.
are people who disagree with you. I'm not saying I'm one of them, but I know, like, I've talked to some veterinarians that, wildlife veterinarians that would strongly disagree, and like Audubon and people like that. So it depends on where you're coming from.
in Japan,
just-
I'll point out, they have very few feral cats because
And
people
where?
collectively do not allow that. Basically, they have a
Oh,
very
right,
strong
right,
culture of spaying and neutering.
Right. No, I mean, and that's absolutely, it's always better to go upstream and stop the problem before it happens. Always, absolutely. And so it's just the issue now that we have so many that we have to figure out a solution for. And then, so really what I wanted to do, I don't know what time it is.
We're at 6:39, and there were
Okay.
some comments as you were speaking.
Okay. let's hear it.
Martinella also came up from, I believe, Adina. Brandy says it reminds me of the cats brought into China to control the bird problem that spiraled into having consequences on the human population. And then Deborah added, also greatly impacts people with decreased immunity, such as people with HIV, AIDS,
Right.
and cancer.
Yes. All of those are really great comments. And I think that the whole idea of invasive species, I think anytime humans try to solve a problem, bringing in a new species, it never goes well. And so I think that those are all really good examples of what we're talking about here. And more examples of why, why this idea of the cats is impacting human health. So I appreciate all of that. So let's take a little time and now just brainstorm. So if we were going to say, let's put together a team, a transdisciplinary team to try to address this issue of feral cats. Who are the players? Who would we want to bring to the table to join the team?
Veterinarians, and we also might want media.
Good. Yeah.
We have
Absolutely.
vets, clinicians to educate patients from the chat, veterinarians.
Yeah, media is always important. We always need to, or people who are good communicators.
Local health departments?
Mhm. I think certainly some more behavioral health professionals are going to be important because, or just people who understand how to, the whole idea of team, like making, I guess, conflict resolution.
Yeah.
There's very strong, and whenever there's strong emotions, I think that has to be a consideration. You have to be able to come together and listen to each other.
We have animal nonprofits, biologists, human healthcare providers, neighborhood organizations like HOAs, sociologists, anthropologists.
That's great. So that's exactly right. So I think bringing together that team is the first step. And so, and then what the next step would be thinking about how you could, so we've already talked about the impact of the cats on humans, animals, and environment. So then the next step is to start brainstorming on what are some of the downstream solutions of this team on so we have put together the team, and then what are some things, so Shannon talked about Shannon and Leslie both talked about spay neuter. So certainly, I mean, in my opinion, as far upstream as you could go, the better. So doing that with pets before they once they're become feral, that they're already spayed and neutered is ideal, right? But then Shannon's brought up this, what is it? It's called, like, what's the acronym? Spay, neuter, return, or?
It's TNVR, trap, neuter, vaccinate, release.
Yes. Okay. So, and is that the recommendation of the Humane Society currently, or no?
Well, there's a lot of organizations like Alley Cat Allies, for instance, that advocate for feral cats. And I think most humane societies do advocate for trap, neuter, release. We had a working cats program also. So we would take problematic feral cats or ones that were in danger, or strays, or ones that just couldn't live outside. And we would put them, for instance, in people's barns if they had mouse problems.
Oh, right.
So we had a whole campaign.
Yeah. I think I don't know currently about the Humane Society, but I think that they have moved away from the trap, neuter, release, and gone more to eradicating because of the overall impact on other animals. But that's I don't think it could ever be all or nothing, right? I mean, I don't think you would ever have that be a solution.
I mean, the problem with I think there are a couple of problems with eradication. One is which people usually aren't down with wholesale slaughter of cats, which is what it is. But there are circumstances like where there's sensitive wildlife areas with rare species, for instance, that can be, the Galapagos Islands are a great example of where they do not tolerate cats on the islands. They just can't, because it will harm wildlife.
Right. And I think that's a really good point. And I think the point that Shannon's making is there are no blanket solutions. That is the important point to make. There are no absolutes. And that's why the transdisciplinary, that's the only way a transdisciplinary approach is ever going to work, because you're never going to come to absolute agreements. And so I think you come to your solutions based on always looking at the cost benefit. And so, like, where we are working is we have a pretty significant feral cat population. And so what we're trying to do is keep them in areas that won't have runoff into our estuary. And so we're working with the health department, looking at the cat colonies and figuring out, like, different ways to where to focus their efforts. And so things like that. So I think that that's an important part of the solutions when you're coming up with a solution. It's, again, because you always have to think about the impact on humans, animals, and the environment. And in this situation, the feral cats are part of the animal population that you have to concern yourself with. So this wholesale eradication isn't the solution, because that's not best for all of the populations. So figuring out that cost benefit is extremely important when we're looking at these types of issues. So does anyone have any additional suggestions or comments related to solutions?
There was a comment, some adoption centers enforce fines if the animals are later abandoned. And Shannon did add, additionally, some people do not feel that eradication will work as it creates a vacuum and more will just move in without addressing people's behavior.
Oops. Right. So I think that's a very good point. So it would never be the solution independent. And I think that just like you have transdisciplinary team, you have a multi-level solutions. You're never going to have, like I said earlier, one specific problem. I mean, one specific solution. So I think that's this really important piece of this. And so back when I was talking about the Einstein thing, you have to understand the problem, like truly understand the problem. So people who love birds want to kill all the cats. People who love cats don't want anything to happen to any cats. And so neither of those is going to be the perfect solution. And so it's understanding each individual situation and having the whole transdisciplinary team coming in and addressing it is how we can work towards a true One Health solution. So we're not going to solve this in 20 minutes, obviously, but I hope this is a good example of what I'm talking about. This is a wicked problem and it needs transdisciplinary, thoughtful, specific efforts to work towards solving it. And again, keeping in mind, you know, that like you may really only care about human health. Maybe you lost a baby or you had a patient that lost a baby, toxoplasmosis, and you just want to never have that happen again. We want to minimize that, but we can't do it at the detriment to the other three components of One Health. So that's pretty much what I have. Does anyone have any other questions or comments or insights that they would like to share on One Health? It's really, I think my intention of this webinar was just to show you that it's complex, but it's essential. I just had this last slide that I wanted to share with you. If you're interested in One Health, I just wanted to share, there's lots of resources, and hopefully I'll see some of the students in the course, but this is the One Health Commission, and they have just a tremendous amount of resources and how information, and there's a One Health student organization. So this would be the first place that I would refer someone if they wanted to learn more about One Health.
Wonderful.
So that's it that I had.
Thank you so much. So I have a comment, eradication would bring an ecosystem imbalance. And then there was another comment in the chat, a city I previously lived in made it illegal to have outdoor cats. I think policies are also important. And I was just thinking,
I absolutely agree. And that's an upstream solution, and that would stop new. And I should say that, I mean, I use the term feral cats, but that it's also outdoor cats. It's any cats that are outside. And so that would be a good policy. And I actually, where I live, they do that as well. And so that's a good upstream solution. So and that combined with the trap neuter release would have an impact, right? Because if you're not adding to the new cats and you can slowly stop the babies being born, then that would be a positive.
Yeah. And that's what I was thinking about as you were speaking, the coordination of efforts, right? Everyone doing their part throughout this whole cycle regarding this issue.
Eradication of outdoor cats lead to imbalances in terms of the mice and perhaps rat problems.
I think that's a really good point, Deborah, and that's, I think, what the other one of the other people had addressed, is that there has to be, I mean, there's a rule. It's just the imbalance, and it's the number of cats, right? I mean, you know, like if there were, I mean, there's always been feral cats. It's just that it's the level in some communities that become the issue.
And it really is, I think, linked to a couple of things that you mentioned previously, Dr. Falls, like poverty. Obviously, you know, our low income spay neuter program was one of the big drivers that helped us to be successful, but also a cultural issue where cats in the United States are considered to be disposable. So you toss them out, or if you have too many, oh well, and let them go by the side of the road.
Right.
And it's much more so than dogs, for instance. So I think that the culture issue is the hardest one to change sometimes. If people could tell me how to change culture, let me know.
Right. Yeah, I would love that someone talked about having an anthropologist. And, you know, I think understanding those types of things are really, really important. And sometimes best solutions are not the most obvious one. I mean, maybe it's educating. I mean, a lot of times it's educating children because they do have an impact in their homes and their communities. And so, and they grow up. Okay. If nothing else, I really appreciate everyone coming. And I'm super happy to see this interest in One Health.
This was great. Deborah, did you want to say something? I see that.
Yeah, I just wanted to say thank you very much, Beth. This was an excellent presentation. We really appreciate it.
Thank you very much. I enjoyed it.
Thank you so much, Beth, for being here and saying yes to the invitation.
Yeah.
And this is a beautiful segue into the course. So if you are able to take the One Health class, we highly encourage it. If this is just a piece of what you're going to get, I'm excited for all of you who are already enrolled. So I encourage you to look into that.
I've already signed up. I'm very excited.
Oh,
I'll try not to talk
Yay.
too much.
Good. I'm so glad. Yeah.
That's wonderful.
Thank you.
Fun. It would be a lot of fun. Okay, well, everyone have a good night. Thank you so much.
Thank you, everyone, for being here. Good
Bye.
night.